The Drug Enforcement Administration says it has seized more than 379 million doses of fentanyl this year alone. The agency reported this week that it confiscated more than 50 million fake prescription pills laced with fentanyl and more than 10,000 pounds of fentanyl powder in 2022. Now, officials say that is enough to kill every American. I want to bring in Regina LaBelle to discuss this. She is the director of the Addiction and Public Policy Initiative at the O'Neill Institute at Georgetown University. She was also the acting director for the Office of National Drug Control Policy under the Biden administration for most of last year. Regina, welcome. Thanks very much for being with us. So this is really chilling when you think about these numbers that I just mentioned. Can you put into perspective how much fentanyl that really is and how much damage it could have potentially done?
So this is the Drug Enforcement Administration's reporting. It doesn't include what's come across the border from the Customs and Border Protection that they've seized. The bigger issue here is also the mortality rates that we've seen in this country. So we're at over 100,000 people who have died from an overdose, primarily driven by fentanyl. And these press pills are particularly problematic because they are often disguised as something else. And at a time when we've seen drug use, substance use among adolescents, 14 to 18-year-olds, they're at record low rates. But at the same time, we're seeing increases in overdose deaths in that same population. So they may think, a young person might think they're getting Xanax or some other pill, often bought online, when it's really pressed fentanyl. And young people, 14 to 18-year-olds, it's not a huge number, but we are seeing increasing overdose deaths in that population among people who are buying these drugs online. So that's why, the seizure is an important piece, but it's not the whole story. There's a lot more we can do in terms of, the international side, far from the border when we're looking at illicit finance. How do we take away the profits from these international drug trafficking organizations?
So, on that point then, Regina, what is the cause of this uptick of fentanyl in the U.S.? How is it actually getting here?
So it used to be that, we had fentanyl that was coming in through the mail or, by planes. Now we're seeing it's mostly coming through Mexico into the United States, where often, it's being mixed either at the street level or by the cartels into cocaine, methamphetamine, et cetera, other drugs in addition to heroin. But the majority of overdose deaths, over 70%, involve fentanyl. So, it is a very potent medicine, but most importantly, it's really cheap and it's easier for cartels to traffic. It's easier to produce. It's it's not like when we used to just look at, poppy fields, or it's a synthetic drug that's produced in labs.
So given those factors, Regina, is there anything the U.S. government can do to curb this and the opioid crisis more broadly?
Yes, there's a lot the government can do, and Congress has before it legislation, in the omnibus bill, in the budget for next fiscal year, that has some important pieces of the puzzle. So we have to make sure we're reducing the harms associated with substance use, with these lethal forms of drugs. And that includes syringe services programs, fentanyl test strips, so people know what they're getting. Increasing harm reduction programs is one piece. And Congress has before it legislation that can reduce some of the barriers to treatment. About 12% of people with a substance use disorder in this country get treatment. If you think about that in comparison to any other disease, that's appalling. That's not the level of treatment we give to someone with heart disease, with diabetes. And if a substance use disorder is a disease, we need to treat it as such. So there's a lot we can do, including going after illicit finance and also in-country corruption on the supply side. But, the Drug Enforcement Administration and the Biden administration acknowledges that this isn't a one-shot deal. This isn't just about the supply side or seizures at the border. It has to include the entire issue of treatment, harm reduction, recovery supports, and preventing substance use from even beginning.
So a moment ago, you mentioned this trend that we have been seeing in the younger population. A CDC study found that adolescent fentanyl-related overdose deaths jumped 350% between 2019 and 2020. You've talked about this a bit, and I wonder, Regina, I imagine there are going to be some parents out there wondering what it is that they can do at a micro level, right? Because what you've laid out here is a problem that really seems to be almost insurmountable with the business interests here of the cartels and the trend that we are seeing, again, among younger people. What is it that parents and caregivers and loved ones should be looking out for?
Right. So, one thing is to make sure you're talking to your kids about, how they're feeling, their mental health. And there are ways there's some tools that the Substance Abuse and Mental Health Services Administration has that can help parents talk to kids about substance use, about alcohol, as well as other drugs. So make sure those lines of communication are open. Getting early access to mental health care if a young person thinks that they need Xanax or they need, they're going online to purchase these substances that they don't really know what they're getting. And then the third piece is that online presence, making sure you're aware of what your kids, if they have access to some of the social media sites that have availability of these drugs that are really counterfeit drugs masquerading as Xanax when really what you're getting is fentanyl. So, communication and making sure you're aware of what your kids are watching, are looking at on their phones is really important.
All right, Regina LaBelle, critical information for parents. Thank you so much.
Thanks so much.
If you or someone you know is suffering from substance abuse, you can call the Substance Abuse and Mental Health Services Administration's National Helpline.